inspired you to enter this profession?
It's been my mother and father both, actually. My mother has been an Ayurvedic doctor. She's still practicing, and in 1950s she completed her Ayurveda degree from Mumbai University, and she has been practicing Ayurveda till today. And from her, my father was also inspired towards naturopathy. So both of them were practicing when I was born. And they had a clinic for infertility especially. So people from all over the world, I would say, all over India, all over Maharashtra, they used to come to them for treatment of infertility and some other chronic disorders. And since childhood, I have been inspired, I have been seeing them working on various difficult problems, untreatable through modern medicine, and which were treatable through Ayurveda. And the medicines used to be made in our house itself. So I could see the making of medicines in my house in childhood. So I was very much influenced by the fact that majority of the disorders which were untreatable through modern medicine and through various big gynecologists and big medical professionals at that time in 1960s and 70s, when test tube baby was not born, it was not invented, that technology was not there to treat infertility. At that time, Ayurveda was an answer, and quite reasonably cheap answer towards the problem infertility and some of the difficult problems like kidney stones and liver problems. I remember she used to treat, and so it was a big influence on my mind that what modern science could not do, our ancient science could do. So that inspired me to become a doctor. And my father used to say, I was interested in a lot of performing arts also. When I was a child, I was a musician. I learned music, Indian classical music when I was a child. And I wanted to become a singer and also an actor. But my father used to say that this is the only profession in the universe which will give you a lot of blessings from the society. A lot of people will be inspired by you, and people will give you a lot of blessings which will make your life worthy of living, means worthwhile. You will feel that you have done something for the society. This is the best profession in the world. That you can get name, fame, and also because of the society admires you, society also pours in prosperity for you. So it's all together. It's a mix. So he always inspired me to become a doctor. Then I told my mom that I wanted to become an Ayurvedic physician. But she said that, okay, she is an Ayurvedic physician. She said, no, not necessarily I should also become an Ayurvedic physician. She wanted me to become an allopathic physician. I said, why? Because I am so much inspired by Ayurveda and Panchakarma and its effects on various chronic untreatable diseases through allopathy. Why she wanted to become, wanted to make me an allopathic doctor? She told me that I should know whatever the best modern medicine can offer for a particular problem in the society. Any medical problem, whether it is acute or chronic. For majority of the acute problems, we still need allopathy. So I should know allopathy the best, and wherever there are lacunas in modern medicine, we should fill those lacunas through Ayurveda and Panchakarma. So that's why I became an allopathic doctor. At the same time I studied Ayurveda from her, and also I did my Ayurveda.
What is your concept of Vedicure?
As I have told you that since childhood I have been seeing my mother treating untreatable illnesses. When I went to medicine, one of the best medical colleges in the country, or I would say Southeast Asia, that is GS Medical College, KEM Hospital, everybody knows. And when I entered the college, I learned my first year anatomy, physiology. Second year we went to wards and we went to the OPDs, and we saw that some of the diseases like chronic arthritis, then diabetes, then heart disease, high blood pressure, cancers, and so many other chronic diseases, neurological illnesses, hematological illnesses. All those illnesses were almost untreatable. They were just maintained, and majority of the cancers were given just palliative treatment. So there were lot of lacunae at that time, I realized, in modern medicine, which could be filled by alternative medicine or through Ayurveda. And I kept on noting various factors like which are affecting those illnesses, and how those illnesses were treated in allopathic settings, and what were the shortfalls or shortcomings of those illnesses, and what were the prognosis of those patients suffering from those diseases. So I kept on noting various things, and then I decided at that time only to start studying alternative medicine apart from Ayurveda, because while studying Ayurveda I understood that contemporary Ayurveda also had some shortcomings or shortfalls, which because of which through Ayurveda only we could not treat many of the chronic illnesses. So allopathy had its point of treating acute illnesses. Then Ayurveda was filling the gaps, but not up to the mark, not fully. So there was obviously a chance of having some other systems of medicines also to enter. So I studied naturopathy. I studied acupuncture, acupressure. Then I also studied hypnosis, some other systems of medicine like osteopathy, chiropractic, then magnetotherapy, then aromatherapy. All these systems of medicine had their own ways of treating patients, and of course they had role. Means when I saw patients treated by acupressure or acupuncture, I could understand that those systems had role. And at that time, by 1980s, World Health Organization had accepted acupuncture as one of the methods of treatment, and Chinese had already spread acupuncture all over the world. Naturopathy was also gaining importance slowly. Homeopathy also had some role all over the world, and of course in England and in Commonwealth countries, homeopathy was gaining importance. India had many colleges of teaching homeopathy, and homeopathy is one of the very important systems of treatment in India at that time also, and even today. So I started gathering information about various systems of medicine, started learning them actually. And being a classical musician, I also learned classical music at the age of 9 or so, and started realizing that Indian classical music and all other systems of music had some role in treating psychological problems and psychosomatic problems. So I thought that was also very important aspect of my treatment. So at the end of the day, I understood that each and every therapy has got some good points and some shortfalls or shortcomings. So I thought, why not combine all of them together? Because for me, Pati was never important. Being an allopathic doctor, a musician, music therapist, a hypnotist, a naturopath, and so on and so forth, I never felt that Pati was important. What was important was suffering patients. People were suffering from various disorders, and people had to be treated. They had no answer, and at that that's why I decided to combine everything so that people get the advantage of all the systems of medicine at one point. And the best treatment available in the world should be made available for any person in the world. Anybody coming to us should get the best of all. Means if allopathy is required, allopathy should be given. Where Ayurveda has a role, Panchakarma or the cleansing and rejuvenation has the role, it has to be done. If acupuncture for pain is required, acupressure is required, it had to be done. Cleansing through naturopathy was required, it had to be done. Yoga and meditation, one of the very important aspects of my treatment apart from Ayurveda and Panchakarma, because I feel after a person gets treated, yoga and meditation would keep him healthy. Or a healthy person, if he has to remain healthy, Panchakarma yoga is very important. So I did even go to one of the biggest institute of yoga and served as a director there, Kaivalya, and learned about yoga research. So when a person comes to me, gets the whole package of treatment. So majority of the disorders which are untreatable through modern medicine or any single pathway, means it's not that only modern medicine has to be blamed. It might be that a person goes to an Ayurvedic physician, cannot treat a particular disorder holistically or completely. Or a homeopathic physician may not be able to treat. A naturopathic physician may not be able to treat. A yoga guru, he might say that everything is curable through yoga, but at the end of the day, majority of the patients have to run for emergencies to their allopathic doctors. So if that was the situation, then I decided that everything is important. Let's give society and patients a package, and that is the concept behind Vedicure. I know it's a long answer, but the answer was required because nobody would understand the concept easily. Because at the end of the day, any patient coming to me should get the benefit of all the pathis existent all over the world, and whichever is the best or a combination of those therapies for a particular disorder, so that that disorder can be treated holistically with an integrated approach, and we will aim towards the cure of that particular problem, not just maintenance.
What is your area of specialization?
Well, it's a very difficult question to tell you, because I tell people that holistic and integrated medicine, in Hindi I call it Sanyukta Upachar Paddhati, is effective in almost any disease. Means a common cold, a person coming to me from common cold also could receive the same Sanyukta Upachar Paddhati, which will be a combination of some Ayurvedic medicine plus Nasya in Panchakarma and Jalaneti in yoga and some Ayurvedic diet, so that his common cold gets healed within next 2 to 3 days. Otherwise, we generally know that common cold, if treated with medicine, lasts for 7 days. If not treated, lasts for 7 days. Correct. So, at least with this holistic approach, we can treat common cold also, and from common cold to cancer. Means even difficult diseases like cancer could also be treated holistically, so that some of the diseases are some of the cancers are reversible. Like everybody knows, like some of the cancer, like breast cancer, is reversible, and some of the cancers in which you can prevent metastasis, you can lengthen the patient's life, so longevity could be improved or increased. So these are two extremes. But apart from that, I generally like to treat chronic diseases.